Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Tonight we are talking about taking care of your teeth and having good oral hygiene. ExpressCare's Dr. Jitka Lom is here providing us some great tips, and now we have some viewer questions. Is it true that bad oral habits can affect your speech and chewing?
They can, especially in children. You know, if they have a painful, sore area of their mouth, they're going to have difficulty chewing hard foods. They won't want to eat vegetables and fruits, and you know, they may have trouble even speaking or lisping. So yeah, very important.
Okay, and the next question is, have you heard, Doc, that you can actually smell if someone has a cavity?
If it's a very deep cavity and there's an abscess, meaning there's an infection that's deep into the tooth and also into the gum, yes, you might be able to smell it. Sometimes we'll see people with very large abscesses and they will have quite a bad odor coming out of their mouth.
Okay. How do you recommend establishing good routines for toddlers?
Okay, so you know, toothpaste can be a little harsh for babies. One thing you could do is just use a soft brush, the baby toothbrush, and brush their gums right from the beginning. They don't even have teeth yet, but you just get into the habit of brushing their gums, cleaning the area, and they'll get used to that. And you don't even have to use any toothpaste. Later on, you can buy baby toothpaste, which is still pretty spicy for some little people, but maybe just a very tiny little bit of that. But just getting into the habit of playing with your child around the toothbrush area, you can put a timer on or whatever so that they learn that at least a minute of brushing for their mouth.
Okay. Is using an electronic toothbrush more effective? I think that's a great question.
It's a great question. Sometimes it's more effective because often those have a timer in them or a song that goes along, so you have to brush your teeth for that length of time because, you know, some people get bored, and especially kids, they'll be done in 10 seconds and that just isn't long enough. Yeah. So an electronic toothbrush can be helpful. Also, the vibrating motion of the bristles can be extra helpful in cleaning. One other thing that we should mention is you should try to brush your tongue. You should brush your teeth and floss, brush your gums, and then also try to brush your tongue because you're removing, again, layers of bacteria and film from that area. And if you tend to get tonsil infections like sore throats all the time, you can reach back and actually brush your tonsils. And this is sometimes a little challenging, but if you do that, especially if you're somebody who has like big crypts or holes in the tonsils because you keep getting infections, that's going to cleanse those. You won't get food and bacteria stuck in them, and it's an easy way to keep clean in your throat.
Interesting. I've never heard of cleaning your tonsils. Yeah. Okay, is whitening your teeth safe, and does it make your teeth more sensitive?
It's very safe. It can make people's teeth more sensitive if they have sensitivity already. Some people have very sensitive teeth, and hot and cold or any chemical might bother them. But for most people, it's very harmless and safe and effective. As we all get older and we drink coffee, tea, and smoke cigarettes or whatever else that stains our teeth, they get yellow, and this is a sign of aging that people sort of subconsciously notice. So brightening your teeth can make you look a little younger, fresher, and brighter.
Okay, and I know you offer that in one of your clinics. And then just wanted to also ask you a little bit about, there's so many different toothbrushes, so many different toothpastes on the market. The most recent one I've just heard is someone was telling me that Amway has this amazing toothpaste that everyone wants. I've never tried it, but just what do you recommend for a good toothpaste?
With toothpaste, there's a couple of factors to think about. One is there should be an abrasive in your toothpaste. That's usually baking soda to allow that plaque to be removed. There should be some fluoride in your toothpaste, but for some people that are sensitive to fluoride, it may cause some breakouts around the mouth. So be aware that that may be a possibility. But in general, people should use a fluoridated toothpaste. And then nowadays they put a lot of extra whitening chemical in the toothpaste, and so some of the toothpastes are getting stronger and stronger and stronger, and they can be really very harsh on your gums and teeth. So you might not want to use those all the time. Stick with the gentler toothpaste and a little bit more action.
What about baking soda? I've heard of making a paste.
You can. That's a very cheap and easy way. It doesn't taste very good, but it's very effective to just use basic baking soda from your refrigerator, mix it with a little cold water, and it'll make a little slurry of paste, and then you can just brush with that. And that's great for people with sensitivities, with tooth sensitivity, or with sensitivity to chemicals.
Okay, and our last question I wanted to ask you, and this was not from a viewer, but just in general, you see a lot of people that have decided to not smoke, but they chew.
Right.
They chew tobacco,
Yeah.
and I know that that's becoming more and more of a concern, and I'm sure, can that have effects on oral hygiene as well?
For sure. The chewing and also the betel nut that people chew here with tobacco or with the acidic lemon and so on, and the leaves and all of that stuff, that's really awful for your teeth and also for your gums. Definitely a risk factor for mouth cancer, tongue cancer, tonsil cancer. Yeah, so something to really stop. Plus, you know, as far as the health of your teeth, it's really bad for that. So want to lose that habit.
All right, sounds good. Well, of course, thank you so much for
You're
coming
welcome.
in. And of course, our viewers can whiten their smiles by visiting ExpressCare for bright white services, right?
Bleach
bright.
There you
Bright.
go.
Sorry, bleach bright.
Yeah, sure.
Thanks, Doc, again for coming in. We will
Thank
see
you.
you again next week when we will be talking about psoriasis. Send your questions to healthyliving@KUAM.com. We're back right after this.